Good evening, Central Indiana. Welcome to Porch Time live from JTH Construction Studio. Doc's in the house with us tonight. Dr. Applegate. He's got 1,000,003 letters in front of his name, and I always leave him off, and he gets mad, and he instantly starts making me want to do stretches and stuff, and makes me uncomfortable. No, he's a good dude, and we're happy to have you, man. Real quick, let me go over my sponsors. Of course, we're live from JTH Construction Studio. American Basement Solutions, 1-877-409-2837. Contact Larry Ralph Sr. for all your foundation needs. What's up, Keaton? Hello, Jack. Hello, Marilyn. Fathom Real Estate, Teresa Messmer, 765-341-8911. Drink Creek, Cedar Creek, it'll be rolling back around. We've got concerts coming up in the spring. Rob's going to be on soon enough to announce all those. Bland & Boys Lawn Care, 765-315-9656. Findhelp.org, that's Judge Williams' group. Get on there and look around if you need help. All sorts of areas. It's a pretty cool site, actually. Wayman's Furniture Appliance and Mattress, 765-342-4339. Mark has ads on our page every day, either wanting help or something's on sale. Gotta appreciate what they do. Wellsprings, Bob Goodrum's group, 765-346-6661. They were on the, I know Bob was on the field last night at the Colts game. I seen him post. He does the flag at the Colts game. Helps with the flag.
That's cool.
That is very cool.
They had a light show.
Yeah. I seen I didn't watch the game, but I saw the highlights to it.
Yeah.
Stids Comfort System, 765-346-0195. That's a good number to have right now with furnaces and things like this you'll need for the cold air coming in. And, of course, we have Hoosier Web Nerd, 317-640-4398. And I don't want to forget, Livewire is a newest sponsor for some reason. I don't have that written down. But Livewire is one of our newer sponsors. Tommy's a great dude, and we're happy to have him on board. And then, of course, Logan's Cosmos, 765-318-3388. Doc, how you doing, bud?
Pretty good.
How was Thanksgiving?
Oh, I had probably like half of a candied ham, so I ate quite a bit. My uncle makes one.
You didn't eat like me. There's no way.
No, do you? Yeah, it was. I had my first two plates. It was the candied ham, mashed potatoes, corn, and mac and cheese.
Mac and cheese,
which I know that was a debate.
No.
My second plate.
So much hell for that, you have no idea.
Yeah.
What's up, Mike?
My second plate was the exact same thing. And then my uncle was like, "Oh, I made too much ham," and I was like, "Oh, just give me some time." So I had two more plates that were just ham. I can't
eat ham like that.
Oh man,
I can eat a little bit, but it's not my favorite. No, I like pork. I like chops and bacon and sausage, but ham like that, spiral ham, I just cannot do. Yeah. I don't know why.
Obviously this isn't the healthiest way to eat a ham, but it was I think it's marinated in a 2 liter of Coke.
See, my ex used to make it like
maple
that.
syrup, brown sugar, and maybe honey as well. I can't remember.
I don't know about the honey, but yeah, a lot of people make it with the Coke.
When it's sitting in that tray, it's covered in about 2 inches, 3 inches of liquid. So
pure sugar, Dr. Applegate.
It's good every once in a while. So,
how you doing, Mike? What's up, Keaton? Yeah, one holiday down and 2 more to go, and I'm sure. The big January push, everybody, how busy, I'm jumping way ahead here, how busy does it get for you, injury-wise, middle of January on?
It just kind of depends. Like,
I can see everybody, gotta get in shape this year.
Yeah, that's
New Year's resolution.
That's a normally like the end of the year is when things pick up because people have met their deductibles, so they're trying to get everything taken care of that they can.
Yeah.
But kind of like the thing that we're going to talk about today, the open enrollment, that's going to apply to everybody who is working towards kind of.
He did it today. I just said something to him right before we come online.
Yeah, so there's trigger point dry needling, and then there's acupuncture-like dry needling. Trigger point is typically the most uncomfortable, and it is the least evidence-based because it relies on our ability to find trigger points, which is very, very poor.
So he did trigger point.
Yeah. So, and if like there's areas that are like really uncomfortable, like your hands are very uncomfortable. I do some dry needling for carpal tunnel, but I don't do the trigger point style. If you have it in your feet, for like plantar fasciitis, that can be really uncomfortable just because you have more nerve endings in your hands and feet.
I'm sure this was for his ankle, right, or ankle or right by the leg area where he broke a bone.
Yeah. It depends on the style. I'll say the trigger point style is the most uncomfortable for patients. So
it's all uncomfortable to me.
It's not surprising if you don't like the trigger point style. I wouldn't write off dry needling altogether. I would find somebody that so they're doing auricular needling, which is, well, that makes sense because he's in the Navy. So they are
both calves.
Yeah. So here's the easiest way to like figure out if you had trigger point style. With trigger point style, they're basically going to take their fingers and they'll poke around and they'll be like, let me know where this is tender at. And they'll tell you that it's a trigger point. Really, it's just a tender area.
Soft spot.
Yeah. And then they'll take the needle and they stick it in and then they will bounce it up and down and go in all directions.
Nope.
So that's the trigger point style, which there's a lot more tissue trauma created from, bouncing the needles up and down.
You're searching, aren't you?
Yeah, I mean, you're trying to elicit what's called a localized twitch response when you do that. So, like, as you stick the needle in, like, you might feel, like, as a patient, you might feel your muscles kind of, like, twitch real hard. And then the more that they do that, the more of those responses you'll get, and then it'll kind of fatigue out, and you won't get any more.
What if she wanted to put in his ear?
So, auricular needling is more acupuncture style dry needling.
Oh, so he should have took that route.
So it'll probably be uncomfortable because your ears are a sensitive area. But there's a lot of effects that work to relieve pain that come from needles going through our skin. So, like that's why like when
this
you go
is the
to
most uncomfortable stuff I could possibly talk about.
Needles, yeah.
Yeah.
Like the big difference between the trigger point style and the acupuncture style. If you go to an acupuncturist. So there's physical therapists that do trigger point style, there's physical therapists that do acupuncture style, and then there's acupuncturists who do acupuncture style. And all three groups have kind of like differences.
Right.
So like the trigger point style is Western medicine. They're going to be poking around with their hands trying to find trigger points, and then they just bounce a needle up and down in that area.
Nope.
And then there's the acupuncturists who, like, you might have shoulder pain and go to an acupuncturist and get needles from like the base of your skull all the way down your back into your foot and maybe some in your shoulder. And that's because acupuncture is more traditional Chinese medicine. So they're thinking of like your qi and your energy channels, and they're putting, like, they'll say, okay, your qi and your bladder channel is stagnant. So we're going to run needles through your bladder channel. And
you put needles in my back, my bladder's not going to be stagnant. I guarantee.
Your bladder channel goes from like the base of your neck or base of your skull all the way down your back and into your foot.
Really?
That's an acupuncture thing.
Okay.
Now, I do acupuncture style or acupuncture like dry needling, but I'm doing it from like a Western medicine approach. So, yes, pretty much. Pretty much.
Well, healing through trauma, yes.
So you get that through both acupuncture style and trigger point style. Anytime we stick needles through our skin, there is an inflammation response that is elicited.
Your
and
that's saying, get the hell out of me.
Well, it's saying, hey, like, so when we stick needles through the skin, especially with trigger point style, and they bounce it up and down a lot, like they're creating more tissue trauma. So it promotes a lot of blood flow to the area.
Okay.
Which is how our body, like, inflammation's not a bad thing.
Gonna heal it.
That's how our body kind of kickstarts our healing processes. We also get a release of our body's like naturally produced opioids that are stored in our skin cells. We get production of two like chemicals in our brain that are responsible for pain relief. It's norepinephrine and serotonin.
You know this stuff well, don't you?
There's a lot of, I have to explain it all the time because I do it with my patients quite a bit.
But you went to school for it too.
Yeah.
You're very good at it.
But yeah, basically so like if I'm doing dry needling, I tell people like I'm going to stick these needles in some areas that are like, if somebody's having shoulder pain, I'm going to stick the needles in their shoulder, not through their bladder channel to get their chi to flow better.
You're going right to the target.
Yeah, I'm using the needles to elicit certain like physiological responses from your body to get you to feel better. And dry needling by itself is good for like carpal tunnel, and it's good for headaches, but it's not good for most like tendinopathies, tendinitis type things, like most joint pains.
So
like you want to do
with
exercise.
The broken bone, what were they searching for?
So and like it really depends.
You don't know the whole
on
case, right?
Yeah, it really depends. He probably has some like range of motion deficits in his ankle.
Mm-hmm.
So like if his ankle can't move fully, all of the soft tissues that cross that joint,
Right.
they're going to be under more like load, under more stress and strain. They're going to be tighter. They're going to be weaker than normal. So you can use the like dry needling as a way to kind of reduce pain in that area, kind of promote some flexibility. Again, I would probably do some other stuff on top of just the needling, but it really depends. It's like a patient by patient basis.
It's fascinating.
But the auricular needling is really popular in the like military setting.
Really?
Mm-hmm.
I've never heard of it.
I know there was a documentary that I was watching, and there's some research to support this, but doing auricular needling, taking veterans off of opioids by doing auricular needling.
There you go.
Yeah. So like the dry needling, especially if it's an already sensitive area, like I might like for me, if somebody has range of motion deficits, I'm probably not going to do dry needling. I'm going to have them doing some joint mobilizations. Like he broke his ankle. It depends on where
I think he was lower leg.
Lower leg.
Yeah.
So it depends on where the break was. If it wasn't one of the actual ankle bones, I would probably actually crack his ankle, like adjust his ankle.
Right.
And then I would probably show him some like banded joint mobilizations that he could do to take care of it on his own. So that'll free up some motion, and then you want to like start strengthening through your new range. That's how you get your mobility to improve. If you just do dry needling, like some people will say, "Oh, I liked that." Other people will say that they didn't.
I'm with you, Keaton.
So it really depends.
Yeah, that's why I don't have tattoos. I'm not a needle fan.
Yeah.
Seriously, I would love to get a tattoo, but the needle thing.
Yeah, the needles that we use for dry needling, like the lead in a mechanical pencil.
That's what you said.
Yeah, it's 0.7 millimeters. Like the ones I use are anywhere from 0.18 to 0.3. So it's very, very small relative to the diameter of your lead in your pencil. But
it doesn't help me though. But
yeah,
you're very good at it, and I've had people from the show contact you, and you've worked with them, and they've given you nothing but praise. But before we get too far into this, you're here for a specific reason tonight. You're offering a pretty good deal at your facility, which you have moved. You're in the back of right now, and I want to say it's 270 East Morgan.
Yeah, so our actual building location is 270 East Morgan Street, Building 2. But if you put that in on Google Maps, it's going to take you to the wrong building for whatever reason. So if you type in 262 East Morgan Street, it drops the pin right on our building. So,
but the place is in front of you now. It's the Cave, the haircut place.
Yep, and then
the barbershop.
And then T&P Plumbing.
And you're on the back side of that building.
We're right behind it. So there's a little alleyway right there by the Cave.
Yep.
If you pull down that alleyway, there's a big white garage door with a little white door next to it. That's our building.
Awesome.
We're still working on getting signage.
Yeah, you need signage.
Yeah.
But you're looking to do some open enrollment.
Yeah, so
you're in the midst of that actually.
Yep. So that ends. Our open enrollment period ends in 3 days, 4 hours, and 43 minutes. There's a little. If you click on the little web page, you can find more about it. I can share the info in the comments below. But our open enrollment is basically access to the performance membership plan. So there's kind of two different ways that you can use it. It gives you 12 visits. You can use them however you like. One case is if you have this ache or pain that you've been dealing with forever, you want to get that looked at. If you're having a lot of pain, we can use those visits more frequently. early on. Once I get you feeling better and kind of get you set on the right track to manage your symptoms on your own, manage your condition on your own, then we space those visits out. So that's one scenario that you can fall into. Or if you're looking to become more physically active, but you don't really know where to start, you're just kind of going to the gym and you don't have a plan, but you're at least doing something.
Right.
You can use this membership plan for that as well. So if that's the case, like I will sit down with you, kind of go over what your goals are. We'll come up with an individualized plan for you so that it'll set you up for success. If you've never worked out before, I'm not going to give you something where you're going to be working out 6 days a week doing high intensity workouts.
Sure.
There's a lot of factors that go into being physically active. Everybody's got a life outside of the gym.
Yes, we do.
Part of it is we'll look at your schedule. We'll say, how much time do you feel like you have to devote to being physically active? And obviously, if you tell me I've got 20 to 30 minutes, I'm not going to give you a workout that's 45 minutes to an hour long. So the biggest thing is getting you started on some kind of physical activity routine. And if we're in that category, it's 12 visits. So that gets you 1 visit per month throughout the entire year.
The whole year.
Yep. If you have any kind of aches or pains, we'll address those aches or pains in that 1 visit per month. And if you don't have any, we will just kind of use that as a check-in visit, and you can we'll modify your workout routine based off of how you're progressing. So that's our open enrollment. You can use your HSA, you can use your FSA. If you have a flex spending account, that money does not roll over into next year, so you might as well use it to invest in your health.
Good time of year to do that.
Yep.
Right.
Normally towards the end of the year, people have met their deductibles already. So if you have met your deductible, you can get some kind of reimbursement. Typically, your insurance will help pay for this kind of stuff. It just depends on what we're working on. So
good deal. Got a question I always ask you this. How many people are you currently working with?
It kind of fluctuates.
Yeah.
So I would say I have around 20 to 25 people that I'm working with.
Wow.
On some basis. So it's either a continuity basis where they're seeing me once a month.
Yeah.
That's kind of how I try to transition people into a continuity plan. I don't want you to fall off the wagon once you get feeling better.
Right.
And then we have to go through this process all again.
Right.
My big thing is I kind of, if you're having pain, we come in, it's an hour-long visit with me every single time. We'll kind of go through the factors that are contributing to your pain. We want to identify those causes rather than just treat the symptoms. Once we identify the causes, we get you out of pain, and then we set you on track to doing the right exercises that are going to
don't create the pain
help
again.
Right. We want to keep that pain from ever coming back. Like
Right.
I'm constantly trying to work myself out of a job.
Right.
So, but people are always going to have aches and pains, especially if they're trying to live active lifestyles. It's just how it goes. Like you can't control everything.
No problem, Keaton. I'm glad you popped on here. When I saw your name, I had told him, and I had no idea you had that done today. So anyway, keep me informed on what happens next, because I'll be curious where it goes.
Yeah.
Age groups wise, you work on all ages, don't you?
Yeah. It kind of depends again. So like my main group that I work with is the active adult and overhead athletes. So like I've got a lot of.
Wait a minute, what's an overhead athlete?
So either ball, racket, or barbell. So like your baseball players, your softball players, tennis, volleyball,
Basketball.
Well, basketball's not really an overhead athlete, but I would still work with a basketball player.
Yeah.
And then I have weightlifters that I work with. One of my patients is probably going to go to the Olympics.
Really?
For weightlifting. She's one of she has a meet this weekend, but one of her meets earlier this year, she hit her opening lifts in the clean and jerk and the snatch, but then she missed her bigger ones. So it wasn't the best that she could have done personally. But that meet that she did, she still is in the top 5 all time for her weight class with her worst performance.
Wow.
So
if she improves at all, you think she's going to
Oh, she can move more weight than what she did. She just didn't perform well during that meet. Like everybody has off days.
Bad day.
Yeah.
Right?
So
happens, unfortunately.
but her worst day was still top 5 all time for her weight class. So like
she's a stud.
The amount of weight she's moving is like impressive for anybody, like male or female. So
oh, he goes back to work tomorrow. Okay.
Gotcha.
Good deal, though. Glad you're going.
You can always check out my YouTube channel. There's different playlists that have like ankle mobility, exercises, that kind of stuff. If you get on YouTube, just type in Performance PT Indiana, and the channel should show up. But and it's all one word.
I was hoping it might. That's the YouTube channel, Keaton. Hoping it might recognize it and bring it up, but it didn't.
But I would just go to the playlist that's called Therapeutic Exercise for the ankle, and then literally do any of the ones on there. So within your tolerance. If it's uncomfortable, back off a little bit. So, but you can always shoot me a message too if you have any questions.
I got a question for you as an old guy, and I can already hear your answer. Joint pains, arthritis, or just because we're not mobile enough to keep the joints lubricated enough?
So most people who have just pain, like you're going to end up going to your family doctor first. Mm-hmm. Your family doctor is probably going to order an x-ray.
Waste of money.
Just because that's the family doctors, when it comes to like management of musculoskeletal disorders, which is like your joint pain, your low back strains, any kind of like numbness, tingling that you get down your sure. arms or down your leg, like sciatica. When it comes to managing those conditions, they should just automatically refer to PT. We have direct access in Indiana, so you don't actually need to go to your family doctor first. You can just call any physical therapy clinic and go in there.
That's so important that so many people, because the amount of money you're going to waste on that visit and on an x-ray, and then eventually in 3 trips you're going to end up at PT anyway, correct?
Yes. So that's, that is the whole premise of why physical therapists, like, they changed our curriculum. Now it's a doctorate level degree. It used to be a master's. Yeah, now they work towards like getting complete unrestricted direct access.
Hello, Teresa.
Like if you go to Kentucky, like it's unrestricted direct access. You can work with a PT for whatever condition for as long as you wanted. Nobody will come say otherwise. Right. Indiana, we have 42 days. All of my patients, like if you came and worked with me, I'll write up a plan of care and then I just send it to your family doctor. And when they sign that plan of care, that is effectively a script. You never actually have to go see your family doctor. So going back to the like arthritis and joint pain type stuff, more often than not, it's not because of the arthritis. It's because of the like lack of movement. So we know that getting imaging early on actually makes people worse, not because of the radiation of an x-ray, but if somebody goes in with back pain and then they get an x-ray and they're like in their 40s or their 50s and they're like, oh, you have arthritis, you have degenerative disc disease, that's why you have low back pain. That is the worst thing that a family doctor can do for a patient, because it pre-frames this idea that, oh, it's structural, it's something that I can't change, that happens with aging. Like, that's why I'm having pain. And they're like, oh, we'll send you to PT so that, we can order an MRI. And then the patient comes to physical therapy and they're like, I'm just here for my 6 visits so that we can get an MRI and figure out what's wrong with me. So like that mindset,
you're just a bump in the road to get to where she needs to go, and it should be the other way around.
Right. And then also like with the current like state of how physical therapy clinics are set up, like I also think that that's a losing battle, because a lot of these clinics, like you might be in there with 2 or 3 other people at the same time, and it's not
insurance hoops. But you just discussed that though too.
Yeah, so that's how like there's a reason that insurance companies won't pay for an MRI unless you've been to physical therapy. So like people see that as a hoop, because they think I need that MRI.
Right.
But in reality, you don't need that MRI. We know that getting that MRI actually makes you worse. You're going to spend more money in the long run based off of your, or compared to people who don't get imaging for that same condition.
Right.
So like Medicare, they never want to pay for anything. Like they do all kinds of studies to look at what's effective, like where is our money best spent.
Right.
So there's a reason that they don't pay for MRIs before you go to therapy, because a lot of times we can do therapy and get you feeling better and avoid that MRI. Same thing with an X-ray. Like unless you have fallen off of a horse, you've been in a car accident, there's some trauma associated with your pain, you do not need imaging. Like you have to have some kind of neurological findings that are irregular that would warrant imaging. Pain itself is not a criteria for imaging, yet it's widely used. And that's a flaw of how our like healthcare system's set up.
I see what you're saying. Yeah.
But
so the hoop she's talking about, it should be the other way around. That you really need the therapy more so than the MRI.
Right.
But mentally, it's beating our head, or that's what we think.
Yes.
I got to go to therapy so I can get my. Have you had your MRI yet? No, I haven't. Well, I'm still going to therapy.
Yeah.
Okay.
So like when I worked in the hospital in Brazil.
Medicare replacement policy of the hearts, yeah, any kind of treatment.
Yeah. Whenever I worked at the hospital in Brazil, like we would get patients all the time that would come in and be like, yeah, I'm just here so that we can get our MRI. And it's like, from my end, I'm like, okay, well, you're not invested in your health.
Right.
For like very, I mean, it doesn't sound
but
like
they're going to end up back with you anyway.
Yeah. That's
they're going to go get the MRI and they're going to be like, oh, here's what you need.
It's not going to change.
Go see Dr. Applegate.
Yeah. There's it was a systematic review. So they took a bunch of studies that had already been done and went through and looked specifically for low back pain. Let me pull this up on my phone real quick.
Which is you can't diagnose it, can you?
Can't diagnose back pain?
Yeah.
I think giving people a diagnosis a lot of times just makes them worse. So like when somebody comes, seriously, it does. Like there was a it's a clinical commentary, so it's not like a research article. It's just a couple of therapists were writing their thoughts, but it has some valid points to it. And it's called Sticks and Stones. So it's like if you go to your family doctor and you have this back pain and they tell you you have degenerative disc disease, you have arthritis, you have stenosis, you have decreased space between your vertebrae, like that's why you have pain. What kind of like picture does that paint to you as a patient? Like, are those things that you can change? No,
yeah, I'm done.
And it's just yeah, that's
going to be my crutch, my excuse for the rest of my life.
Right. That is the scenario for, I would say, like 90% of people that go to PT, because they've already been to their family doctor. They don't take advantage of direct access. So they go to their family doctor, they get some imaging. Imaging says, oh, you have these findings, which are very normal findings for people that age. Like going back to the systematic review,
right?
They looked at people from age 20 to 80. These were studies that had already been done. All of the people on this data table, they had no low back pain, but this is the percentages for the MRI findings. So starting at age 40, about 68% of people had degenerative disc disease, but they had no low back pain. Disc bulges at age 60, about 50% had disc bulges with no low back pain. When you get to age 50, it's about 80% of people with degenerative disc disease, but they had no low back pain. The disc bulges, 60% at age 50. It's just very high percentages of people are having these MRI findings with no low back pain.
No back pain.
Yeah, that's not to say that people who have those conditions, like some of that can contribute.
Well, sure.
But in most cases, it's not because of the imaging findings. It's like
something else.
Yeah, it's generally related to their activity level or lack of physical activity.
I worked rehab for years. The best results were the patients came in with minimal invasive testing.
Right.
They didn't know what was wrong, so they didn't have preconceived images. Their mindset was more pure.
Exactly.
As you were saying.
Exactly. Like if like in a best case scenario, I want to be the first person that somebody has ever worked with.
Right.
because it is going to be the easiest like course of treatment. They have no like preconceived notions of what's going on. They're just like, hey, I'm in pain. Like what's going on? And I would never give that person a diagnosis more often than not. Like if somebody's got low back pain and they come to me and I think that they have a disc bulge, I might say like if somebody has sciatica,
Right.
sometimes that can be coming from a like disc herniation. I might tell that person like, hey, it hurts for you to bend forward right now. It sends that symptom or that lightning bolt down your leg. What we want to do is kind of find some movements that are comfortable for you so that we can keep you moving. And then we'll just kind of work within your tolerance as your symptoms start to subside.
Strengthening that back up.
Yeah, we want to like load it in a comfortable way and not make the current presentation worse. We know most disc bulges, they heal within 6 to 8 weeks. Like if somebody lifts a box and they strain their low back, that's the other thing is like a low back strain is not always a disc bulge. Like, have you ever had an MRI on your low back?
No, I have not.
Okay, so you could be lifting a box next week and go strain your back, and then go get an MRI, and they might say, "Oh, you have a disc bulge." Like that's why.
But I probably have a disc bulge right now.
Yes, but that is very hard for people. Like once, like to understand once they've already had the MRI.
Right.
Like once they've had the MRI, they're like, no, I saw the MRI myself. Like I've had people tell me that. I'm like, okay, well, I'm trying to help you here. It's like,
if you'd got an MRI 3 days before you did the damage,
yeah,
you'd already had a bulging disc.
Right. More often.
Interesting.
So there's a lot of benefits to not getting imaging.
Wow.
So.
Dude, that's mind blowing, dude.
Yeah,
and it's goes against our way of thinking that we've been beat into us for decades.
Yeah, like people just think it's the normal flow of how they're supposed to go about taking care of their body. So it's like who am I? They've never even met me before, right? But that's where like I'd like to have people that are from Martinsville kind of working with me a bit more often, but a lot of people don't even know that I'm here, so
we're trying.
Yeah,
we're trying. You need a sign.
Yeah, sign would help.
Need.
Here's the
you need a big neon sign.
Here's the cost analysis. So this was for low back pain. So we know the sooner you get into therapy, the less money you're going to spend for an episode of low back pain. So between 0 to 15 days of like when your back pain started, you're going to spend about $4,222 if you're using an insurance model. This was for Medicare beneficiaries. So you're going to spend about $4,222 if you wait to between 91 and 180 days, so that's about 3 months to 6 months. You're going to spend about $5,964.
So it keeps going up.
Yeah, so the percentages keep going up, or the amount of money that you spend keep going up. So there's no downside to going to therapy first. We're back. We were going to the gym. Stop going. Yeah.
Wow, there's a lot to unpack there.
There's a
Jace is on him.
There's a like a little like thought experiment that I like to do with my patients, and it's like if they're coming to me, like first thing we talk about is like, well, what's bothering you? Oh, my back hurts. Well, why is that important to you? Like I'll ask them why 5 times, like to get to like the underlying.
You're trying to find root cause.
Not root cause, but like what is their motivation for coming to therapy? Yeah. So it might be a fun one to do with your husband, like.
Send all complaints to Brandon Applegate. No.
I would just like, like if you want to become more physically active, it's like, why is becoming physically active more important to you?
Right.
And then whatever the response is, it's like, okay, why is becoming
I'm creeping up in age and I need to start doing something.
Okay, so why do you feel like you need to start doing some kind of physical activity?
Dude, I just told you.
Because you're creeping up in age.
Right.
Okay. So what's bad about creeping up in age and not being physically active?
Well, because it's been beating our head as we get older, we're supposed to slow down.
So
I'm learning from him now.
Yeah. I think it's
his back hurts because I'm on his back all the time. I have no idea. You need to bring them both to your shop. That's
It'd be. I mean,
so you put them through the ringer.
Yeah,
I mean,
I really think that it's important to know like why you're coming to therapy. Like, I want to work with somebody who is motivated.
I was gonna say you're putting the responsibility back on them to get their butt out of bed or whatever.
I can only tell people so much, right? Like, I can give you the perfect plan,
right,
to get you feeling better,
right.
But like at the end of the day, the person I'm working with is the one that has to put that plan in action. So it is really important, and I think it like sets patients up for success whenever they have this idea in mind of like, this is my why, like this is what I'm doing this for. So
let me ask you this, and I'm kind of changing subjects on you here. At your facility on a normal Saturday, is there people in there exercising, or?
So it is a.
Here we go. I spin top to bottom.
I would say that you can go take an X-ray of 100 people on the street, probably 1,000, 10,000 people on the street, and there's probably not going to be a single one that doesn't have some form of arthritis.
Oh yeah.
So
I don't know why, but I can tell. I broke a bone in my wrist in the Army and wasn't diagnosed until I was out. And I know someone's like, you need to collect on that. There's guys around here with half arms and half legs, and my wrist is the least of the concern. But man, when the weather changes like this, I'll wake up that morning. Oh, and it just throbs and throbs and throbs. And I got a hip issue. We've discussed it. Both of them.
Yeah.
This last night.
Yeah.
I'm trying to find a spot, and I'm like, oh, great. Storm's coming in.
Yeah.
Why? What is that? Do we know?
Yes, but like.
This isn't the answer I was expecting.
So. Pain is a like very multifactorial experience. So like there are a number, like our brain plays a huge role in why we are experiencing pain. So at some point along the way,
talking myself into pain is what he's saying.
I'm not saying that like you're making it up.
Right.
Like, you're very much like you are having pain.
Oh sure.
Whenever the weather changes.
Sure.
However, your brain plays a very like influential role in like your pain experience. So if you are anticipating that when the weather is going to change,
my joints are going to hurt.
That your joints are going to hurt.
My joints are going to hurt.
Your joints are going to hurt. So like there's
a he makes me uncomfortable every time he comes in.
There's an Australian
much logic.
There's an Australian physical therapist. His name's Lorimer Mosley. He's got a lot of TED Talks out. He's got a book called Painful Yarns. A yarn is like a Australian story, whatever. Sure. But it's a really good book. I recommend it to anybody who's got chronic pain. But he puts it into like layman's terms of like why our perception of how things occur like influences our pain. So like there was this study where they had this piece of metal that was super cooled to like negative 200 degrees Fahrenheit, and they had two groups of people. So they had them sit in this room, and there was a light in front of them, and they would flash a blue light to one group and then touch it to their skin. And say like, like what's your pain 0 to 10? And they would report, anywhere from like 2 to 4 out of 10.
Right.
And then the other group, they would flash a red light, touch that same super cooled piece of metal to their skin, and they would report 7, 8, 9 out of 10 pain. And it's just how like that perception, and it was the same temperature, same metal, like same super cooled piece of metal. Yet these people had two different pain experiences.
I heard this on Rogan, I think. And you got to probably have to research it. I think it was him, but the guy in Canada that got locked in the truck, the freezer truck. He was doing something repairing something on it. Went up inside, door shut on him, locked, couldn't get out. Dies of a heart attack in that truck, and they think that he worried himself to death, and they could tell that he was trying to wrap himself the way he was laying to keep himself warm. Temperature was 43 degrees. It wasn't like below freezing at all.
Yeah.
But he died within less time in hypothermia than what he should have.
Yeah.
And they're like, because his mind told him he was in the back of a freezer truck.
100%.
I'm going to freeze to death. And he literally died.
Yeah.
And I was like, whoa. That's insane.
Yeah, there was a this was like a case study that got published in the yeah,
we won't get into demographics.
We don't have a pain threshold,
right?
But
middle of the red light, right?
But there was a carpenter. This got published in the British Medical Journal. A carpenter who was working, shot a nail gun through his foot, got taken to the hospital, and was in so much pain that they had to sedate him with morphine so that they could cut the boot off. And when they sedated him with morphine, the nail was not even in his foot. It was between his toes. But to him,
it was in his foot.
It was in his foot. And it's like this perception of like, what the heck just happened? Like, I've got a nail in my foot. Like, I'm in so much pain. Like, that's a terrible thing to happen.
Did he feel like
I don't know. There was no interview after,
right.
You know. But
get out.
There is more and more like evidence to support that, like our perception of like our body's health like plays a heavy role in our pain experience. Like there are a number of factors that go into pain. Like it used to be this biomechanical model of pain, meaning like we get some imaging, we look at it and we're like, oh, that's why you got pain.
Right.
Now we know there are tons of other factors that go into somebody's pain experience.
I'm telling you, anybody got pain out there, you need to go to this guy because I don't know, it's your 5th or 6th time in here. And every time it's more fascinating. You got more information. He makes me as uncomfortable as hell because the needle thing. But I'm telling you,
if somebody doesn't like needling, though, like we're not gonna stick with
right. No, you know that, and I know that. It's just my cringe moment. But you know so much, and you're relatively a young doctor, but you're very, you know what you're doing clearly, and I know you're trying to get rolling here in town. What I was asking on a Saturday.
Oh, it's a personal training only type of gym. So it's like by appointment only.
Okay.
Evan Sitzman is the head personal trainer there. He is a completely separate business. I just treat out of that gym.
Okay.
But he's got a variety of patients as well.
Well, I was trying to, like I've shown up at a couple places live and just went live to help promote them. I do that on businesses around town every now and then.
Yeah.
A lot of them aren't even sponsors of the show.
Yeah.
It's just to promote Martinsville and keep business. And I was like, maybe if I come down there and popped in live one day.
Yeah.
But that's not where you're at.
Yeah. Tuesdays and Thursday evenings.
Yeah.
Is I would say up until about 6:30, which that might be too early.
No, that would be. I'm home by 6:15.
But those are Evan's like busier days, and like I'm in there depending.
Yeah.
So like my schedule kind of fluctuates based off of my patients. Like Tuesdays and Thursdays are my treatment days. It could be anywhere from 8 a.m. to 6 p.m. that I'm there.
I just thought maybe one of these nights I'll pop in there, and I'll make sure I'll text you in advance and say, hey, we can just discuss some things. If you have this type of injury, here's what we're gonna do.
Yeah, I do workshops pretty regularly. I haven't done one at PRT, which is the gym here in town. I haven't done one there. I set one up, but it was last minute and didn't get good attendance.
Sure.
But what we could do is put a cap on it and say like 10 to 15 people can come. It would be $10. We'll donate the proceeds to whatever like charity around town.
Sure.
Something like that. That way it's kind of like a fundraiser, or they can donate however much they want to participate in the workshop. I can do a low back pain workshop because everybody's got some form of low back pain, and I'll give them 3 to 5 things that they can actively start doing to help their back pain
get
better. So that could be something that we could do. and then you could, set up shop while we're doing the workshop.
Yeah, I just sit there and talk to you guys and let you guys do your thing, and just to help promote you. I won't even get into bicycling. Folks, he told me some stuff about bicycling before and it's great for you. He strongly suggests bicycling.
Cycling's a good form of exercise.
Men.
Yeah, there's so if you're if you're like on a road bike, so like if you go to a bike shop and you're looking for a seat, it's called a saddle. So they actually make saddles that have a like groove straight down the middle, or there's a big hole, but it helps promote blood flow, so it helps prevent a lot of the stuff that we were talking about beforehand. Yeah. Also wearing some like cycling shorts that have padding in the appropriate places, like that's a good thing. Like when I ride my bike, I've got this full body like wrestling singlet is what it looks like.
I'm not going to go to the gym and wear a singlet. I'm just telling you.
You don't have to do that.
I'd rather Planet Fitness to be like, get out.
You could wear it under your clothes.
Right.
But
which would even be weirder. I go to white, but you just got a singlet on underneath there.
Yeah.
But no, it's about keeping things in place and so they're not getting smashed while you're pedaling, which could lead to other issues, which he discussed with me, which no, I didn't even think about that. But that's more so of your hardcore bicyclist
or even like somebody who is just going to Planet Fitness and cycling. Like if they're just starting out, if you have any kind of like soreness with cycling, there's a lot of things that you can do. It's like make sure that the seat height is appropriate. Transitioning your weight forward or backwards on the seat. And that's the other thing is like just finding a form of exercise that is comfortable to you and is like one that you can do consistently, because that is the biggest thing. There is no bad form of exercise. Like all exercise is inherently good.
Right. It's
just when you get into, doing too much weight with bad form, or you're doing, too much volume with good form, there's a lot of factors that go into it. So that's where like, if you are physically active and you're, having pain, you can come talk to me. We'll get you set on the right track. Or if you're, wanting to start being more physically active, but you're worried about hurting yourself, you can come work with me as well. We'll get you set up on a pretty individualized plan. So
and that's a perfect segue into what you got going on right now. The reason why you're here tonight, you got open enrollment.
Yep.
For the next 3 days, 10 minutes.
Yeah, December 3rd at 11:59 p.m. is when that ends. So there are 8 of those offers still available. I don't want to put too many out there because then I won't be able to provide the one-on-one time.
Sure.
My schedule is limited as it is. So basically it is the biggest discount that we offer. It gives you 12 visits. You can use these 12 visits however you like. If you're, having some pain, we can use them a bit more frequently early on to get you out of pain and then space those out. If you're not having any pain and you're just looking to become more physically active, we'll use those on a once a month basis, and I will kind of set you up on an individualized workout routine so that you have the best chance of achieving your goals, whatever they may be in 2023. So
sometimes you got pain, take advantage of it, get a hold of Doc and let him take a look at you, just to sit and let him talk and his intelligence about pain and body and stretching and muscles and all that. It's amazing. And it's pretty cool that we have someone in town that does this. I don't know if anybody else in town even does this.
We have other physical therapists in town.
Right. They've not been on porch time.
Yeah, that's true. I don't want
I'm not knocking them.
Somebody to, if somebody calls me and I don't think that we're a good fit, like I only see people once a week.
Right.
So through talking, if I'm like, okay, this person doesn't sound like they sound like they need a little bit more supervision with stuff, I'm going to send them to a different physical therapist in town.
Sure.
Because I don't want somebody to just not go to PT.
Right.
So if I'm not the best provider for somebody, I'm going to help get them in touch with somebody who is.
And that's pretty cool.
So I always
You're
do.
not wasting their time, your time,
Right.
their money.
Right. So I do free phone consultations. So if anybody is having any kind of pain, you can call. You can set up a time to
What
call.
is your number?
765-318. Oops. There's a link on my Facebook page to set up a time to call if they want to do that as well. 7400.
Right?
Yep.
There you go. All right, I got one more question before we get out of here, Doc.
Yes.
My stomach after this weekend was hurting me real bad. What do you think? I'm teasing him. He's a ham man. He's a spiral ham man. And he went mac and cheese.
Yeah,
So
on the first plate.
I like it when guests play along.
I'm a menace to society, apparently.
The crap I caught on side messages to me, I'm like,
Yeah.
dude, do what you want. I'm just making conversation.
Yeah.
270 East Morgan is where it's at, but if you Google it, go 262 East Morgan.
Yes.
Google's messed up. It'll pin him. It's in the back alley behind the Cave Barbershop.
Yep.
Stop in there. Get a hold of him. He's got a Facebook page. He's got a YouTube channel that I posted a little bit earlier on the site. And of course, there's his number if you want to set something up. There's people from the show that have gone to him that he's helped. So we know he's good at what he does. And I've known his family forever, so trust me. They're good folks. Anything else you want to add or discuss before we go?
I do have a bi-weekly newsletter. So
Okay.
I send out a 3-tip Tuesday every other Tuesday. So it'll just be a video that you can watch of some like mobility exercises or like shoulder exercises. Topics kind of vary. There's a link to an article that I've written. It could be about anything really, but it's all kind of health and fitness related. And then there is a link to one of my podcast episodes.
Yeah, he's got his own show. The guy's, that's what I'm saying. He's on here jacking around with Porch Time. He's got his own podcast. That's pretty cool.
There's only 4 episodes, so it's slow.
You're going.
But, yeah.
You guys, people, you're going to come January. When New Year's resolution is to get in shape, and you're going to go to the gym, and after the 3rd day, you're going to be like, oh, what's that guy's name that Kevin had on the show? Yeah.
But yeah, having an accountability partner, that goes a long way, especially if you're trying to be more physically active and building a healthier version of yourself. So
good to go.
Yep.
Doc, thanks for coming in as always.
Thanks for having me.
I know sometimes it's a pain to get on here. I'm busy.
Yeah.
With work and life, but get a hold of Doc. Brandon, appreciate it.
Yep.
Hey, if I don't see you, Merry Christmas.
You too.
Happy New Year. I'm sure I'll see you or here to talk to you for it.
Yep.
Guys, thanks for tuning in. Love you guys. We will see you soon.